legs are beautiful, but also larger and,
Yeah.
and kind of hard for me.
Yeah, it is.
Yeah.
It is, and that's where like a lot of times hooking in and leaning, because I also have several very muscular clients that I just have a trouble managing, and it comes in with the leaning, and then just again, meet them where you're at.
Yeah.
You know, like that's okay. How did that feel for you?
Good.
Yeah.
I know I'm totally okay with like lifting it.
Mm-hmm.
If you need to get under there for your placement.
So for her, you might do better like having her leg out just a little bit more. Go ahead and lay down on it. Okay. And if you want to try that, you can come in here. Or if it's just better, just grabbing the leg. Like grabbing the knee is totally fine.
Yeah.
Yeah.
It feels great.
Yeah, it's really fine.
good.
That works out well.
Very positive. Just different.
Yeah, you're changing, you're adapting to what you need to, and that's perfect.
Is that what my customers were looking for?
Bring that guy all the way up in here first. Get all up in there. There you go.
Yeah, like it's there.
Strengthen. Oh, that's good. How does that feel? Feels good. Okay.
But it was like,
Good job.
can I solve a problem?
That was
I
beautiful.
approached the marketing from a very American,
That was beautiful. You did great.
sensibility.
That
And I
looks
said,
wonderful.
listen, are you having problems with low back pain?
How does that feel for you?
Are you tired of your
No, that's
upper
good.
back and neck?
How does that feel for you as the giver?
Good.
Okay.
I have 20 years of
What I need to
pain
do is remember
management
to not
specialty.
Yeah.
I would really
Yeah, what we
love
want to do
work with
is
you to help
lock
you
this
with
leg.
chronic
Sometimes, like if locking your leg feels like you're
There's a link
hyperextending
here
it
below where you
sometimes,
can sign up.
you can put something underneath
And
there, just
then
not.
there were
But usually you want to make
videos
sure that this leg
showing
is
the
nice and
mat-based
strong.
work,
Because we're
showing
gonna
anatomy,
pull her onto
showing
there.
how I was
We're gonna
addressing
lean
something.
back, get this nice
And then I
stretch
could
through. There you
draw
go. How does that
those,
feel for you? Good. How does that feel for you? Does it feel a little bit different?
Yeah.
A little bit more
I'm feeling a
stable?
stretch in my leg
Yeah.
too.
Yeah, because we're stretching all that posterior chain.
So I have a question.
Mm-hmm.
So like, if a person comes with like low back problems and they're not able to like flat on their back, do you like adjust them with like some kind of cushion?
Oh, if they can't lay flat on their back, there's a couple of things that you can do. One, if you guys are like, we want to do, super prone or supine stuff, like flat back, you can take and put a small pillow. I would do more of a flat pillow versus like some of these fluffy ones. You can put that underneath there and just see how that supports. You put on a low
Yeah,
back.
because
the
when
sacrum?
I can't lay on my back too long.
Here, go ahead and lift up. There you go. Can you lift up your bottom just a little bit? There you go, and sit down. And then lay.
Not much better. I should have done that yesterday, but then I was just like going with.
Oh, you're just enjoying it. So this is an option that you can do.
Okay.
Totally fine. Sometimes, like after a while, the client's like, okay, it's just a little too much. We pull it out,
Okay.
right? Another thing is lifting this knee up takes the pressure off of your low back,
Okay.
right? Or if they're just like, none of this works, we just do sideline.
Okay.
Does that make sense?
Yeah.
Please speak up.
Of course.
I don't know why I forgot my
That's
hair.
okay.
Thank you.
Mm-hmm.
Yeah. This is more.
We go from that into the heart and soul, right?
Yes, the holster thing, yes.
Sorry, that's
No, that's okay. I know we have different words and we're all working through it. It's
I
all
know.
good.
I started looking at his holster now.
Mm-hmm. There you go. Right in there. Do you see how you can control her leg with your leg? Good. Okay. How's that feeling for you in your back?
Feels really good on my shoulder.
Good, good. I know you feel that stretch through there. I know, I love it.
You're cheating. You're working on yourself right
Right? And you're getting paid?
now. You're doing super effective
Allows
work to
you
me.
to work on larger clients.
How does that feel?
Yeah.
yeah.
How does all this feel?
I don't know.
A little too much?
Working it out.
Okay.
A little less so.
I like both
Honestly,
of them.
I'm overwhelmed
course,
with
the
the amount of
crossbody is
feedback that y'all provide. So I need quiet.
Do you want me to give you a little bit of a break and not come by as much? Okay, I can do that. And then if you have any questions, just flag me down, okay? Okay.
That's 30 degrees.
Mm-hmm. That looks good. Get it all the way up in there. There you go. How's that feel? Right? Love it? And then lean. Beautiful. Beautiful. How does that feel for you, Kristen?
It's intense. My
It
calves
is.
are tight though.
Yeah.
And so you, when you're that high, you get a little bit of the top of the calf.
Because of those tendons.
There.
Yeah.
Mm-hmm.
Mm-hmm.
And
That's
then,
enjoyable for sure.
how do you feel?
To say the least.
Right? Good
Can
job.
you feel like the edge of my flexibility?
Mm-hmm.
Like right where.
You get, it'll get more the more you do it because you'll keep taking yourself to the edge of your range of motion. And then you'll start moving past it. Oh, that was his, I'm sorry. Mhm. That's the reason I was trying to.
And then what time?
I would do it like probably 5 or 10 till,
Okay.
just because of how long it takes for us to move.
Okay. And then when we do that, just to find out, like we need to move stuff over here.
I was thinking more over there, or we could do it over there. Professor typically stands here,
Okay.
so
It gives me an idea. I'll walk you through how we'll grab stuff.
okay,
and move
that
it.
sounds good. Good job. Good job. That looks really good.
This feels awesome.
And you also occasionally want to check in. Hey, how does that feel on your ankle?
Amazing.
Good. Sometimes that can be a little too much, and that's where you just grab up here. I like to grab the skin because it's less slidey. Good job adjusting.
Okay. Just like cramped up. Just a tiny
Oh,
little
I
bit.
know, right?
Alright.
No, my
There we go. There. Fine.
Yep. You start learning your limitations. You're like, oh man, that sucks.
Still finding that there, Kristen?
Oh yeah. That's a
Ankle's
troublemaker
still
in there.
okay?
You can always scoot up the yoke pants. Yeah.
How does that feel for you?
You want me to do the? I'm gonna try doing that.
Sure. I'm here for you, girl. So yeah, I like to be close. David likes to be out. So it's whatever feels like your base.
Yeah.
Whatever feels like your base. So we're doing very good. I'm not even gonna help you know what you're doing. I'm over here trying to control.
Put it on me. Deep breath in.
There you go. Good job. And lift. Good job. That looks beautiful. Good job. How does that feel for you? Good. Okay. You're fine. You're fine. I check in with the givers because we're teaching them. You just get to enjoy it.
I know.
But you do ask, how does that feel? How does your low back feel? I mean, you have low back concerns. How did that feel for your low back?
It feels good.
Yeah.
But it's like my other side is my problem child.
Good. So then we know that, right? But we know that we're working in that area. Sound good? You guys want to keep going or you want to switch? Because I want you guys to try the leg stuff all before lunch, okay?
Okay.
And then you guys can do whatever you want.
Let me get you opened up. I'm gonna do the open.
That's perfect. Yeah, I'm not trying to rush you, babe.
Okay.